First of all, let me thank Professor Rajiv Jalan for giving me the opportunity to present our last publication of the Journal of Hepatology on behalf of the International Club of Ascites on the new consensus recommendation for the management of acute kidney injury, AKI, in patients with cirrhosis. This was the final result of a 2-year-long process of consensus that started on December 2012 in Venice during a dedicated meeting at which most of the experts in this field attended. At that time, we decided whether we needed to perform large perspective clinical studies comparing our conventional criteria for the diagnosis of AKI and the new criteria proposed by the nephrologist, particularly the kidney disease global improvement outcome or KDIGO criteria. Well, these studies were performed and published, and the result of this study were discussed by the expert. Let me say that the discussion was very active, very passionate, with different positions on specific points. But at the final, we got the consensus on the fact that we should move from our conventional criteria to the KDIGO criteria based on small changes in serum creatinine for the diagnosis of AKI in patients with cirrhosis to make it possible a more timely management of this severe complication in this patient. And in the perspective of AKI, we also realized that it was time to change our previous definition of hepatorenal syndrome by removing any final cutoff value of serum creatinine from the definition to make it possible a more prompt treatment of hepatorenal syndrome by vasoconstrictors and albumin. Let me say that several steps in the new algorithm for the management of AKI in patients with cirrhosis are yet not evidence-based, but they are based on opinion from the experts. But let me say that the new algorithm will represent a very useful basis for the development of future research in this field. Well, we got the consensus on the new recommendation for the management of AKI in patients with cirrhosis because all the experts believe that having different opinion on specific points is always an opportunity for growth of knowledge and never an occasion to divide the scientific community. So let me thank all the experts for their strong willing, for their extraordinary support to the consensus process. And finally, let me thank you for your attention.